Hi, this is Dr. Akshay, and today I'll be talking to you regarding the possible complications of liposuction. And I'll start from the worst to the least problematic complication. Now, the worst complication is fat embolism. Now, fat embolism happens during large volume liposuctions, and it used to be pretty common earlier because people used to do and just try to suck out all the fat. Although it still occurs in less trained hands and people who are not plastic surgeons, who when they try their hand liposuction, yes, it is seen, and the result is obviously a stroke or even death. So that's the worst thing that can happen during liposuction. God forbid it shouldn't happen to anyone. Now, the other complication, which is still more common, is skin necrosis. Skin necrosis again happens mostly in untrained hands and when a non-plastic surgeon does liposuction. Because what happens is that if they are too aggressive or if they don't choose the right size cannula, they are too close to skin, and this ultimately results in the skin losing a blood supply and the skin over the liposuction area just dies. Okay, and then you're left with a large wound, and that has to be fixed later on by a plastic surgeon. Now, the third most common complication is a contour irregularities. Now, contour irregularities is it happens when a liposuction is done by someone who doesn't know the anatomy. Our body has certain curves, and a plastic surgeon or the person who's doing liposuction should try to recreate those curves in the right way as much as possible. And when someone does lipo without understanding these normal anatomical details, this is what happens. Then the next complication is bleeding. Now, bleeding can happen with any surgery. It can happen with liposuction also, because ultimately you're putting a cannula under the skin and moving it back and forth a number of times. So invariably, it can always hit a blood vessel. Now, if it hits a blood vessel, a plastic surgeon can always isolate it and even repair it if required. Obviously, in a case of liposuction, usually just required to tie it off. And then the other complications, as with any other surgery, is infection or delayed wound healing. Now, this usually is not seen much these days because of the good antiseptic protocols that most hospitals follow. Now, unless you go to a shady clinic or someone has done a small course in liposuction over a course of maybe like few days or something, yeah, you can end up with a bad wound as well. So, stay safe and stay informed.